Toothache is one of the oldest and most universal agonies known to the human species. And for most of our story, it was also one of the most inescapable. Picture this: no dentist, no anesthetic, no ibuprofen waiting on the nightstand, just you, a throbbing molar, and whatever you could figure out from the natural world to make it stop. For the vast majority of human history, a toothache wasn't just unpleasant, it could kill you. So how did our ancestors survive it? As it turns out, they survived through a remarkable combination of brutal necessity, inventive desperation, and sheer stubborn refusal to quit. And the full story of ancient dental survival is, in many ways, the story of humanity itself, a 10,000-year-long attempt to solve one of our most universal and persistent problems. Let's start all the way back, before written history, before cities, before civilization as we know it. We're talking about hunter-gatherers roaming the earth tens of thousands of years ago. And remarkably, we have direct physical evidence that even these early humans had to deal with serious dental pain. Take the Broken Hill skull, discovered in what is now Zambia. Dated to somewhere between 125,000 and 300,000 years ago, this individual carried an enormous abscess in the front of the jaw, the kind of infection that would have caused chronic, unrelenting pain, and that, without modern treatment, would eventually prove fatal. Yet this person lived with it for a prolonged period. How? Archaeologists believe early humans may have relied on anything from herbal poultices to, in the most extreme cases, simply removing the offending tooth with crude force, pulling it out themselves, or having someone else do it. There's also evidence that some early humans chewed on tough, fibrous foods that acted like natural toothbrushes, scraping away food particles and bacteria. But for a serious abscess, none of that would have been enough. The most jaw-dropping evidence of ancient dental intervention comes from a site in northern Italy called Riparo Villabruna. In 2015, researchers examined the remains of a 14,000-year-old hunter-gatherer and found something extraordinary: a tiny, perfectly round cavity in one of his molars that had been meticulously cleaned out. Microscopic analysis revealed it was created with a sharp-pointed stone tool, essentially a primitive drill. The precision is remarkable. This wasn't someone randomly stabbing at their tooth. This was deliberate, repeated work. And the haunting implication is that this procedure happened more than once. The person kept coming back to address the same tooth, enduring the procedure over and over again across what was likely weeks or months. This may be the earliest known example of what we would call repeat dental visits. It's a testament to just how badly people wanted relief. But the drilling stories are, in truth, the rare exception. For the overwhelming majority of human history, what did people actually do when faced with a toothache? They turned to the natural world, and they did so with remarkable creativity. Plants, herbs, minerals, and rituals, anything that offered even a sliver of hope. Ancient Egypt gives us one of the best documented pictures of early dental medicine. Around 1550 BCE, an Egyptian medical scroll known as the Ebers Papyrus was written. A massive document over 70 feet long, covering everything from digestive disorders to eye diseases to, crucially, tooth pain. Among its contents is a section entirely devoted to dental remedies, and the treatments described there are equal parts fascinating and, from a modern perspective, rather alarming. One prescription for tooth pain involved a mixture of ground onion, dough, and a mineral called galena, a lead-based compound that, while toxic in large quantities, was widely used in Egyptian medicine for its supposed healing properties. Another remedy called for the patient to chew on the root of a particular herb and then spit into the mouth of a living frog. The frog would then be released, presumably having absorbed the pain along with the herb. Whether this was effective in any measurable way is, needless to say, debated. What's more significant than the specific remedies, though, is that ancient Egyptian society actually had dental specialists. We have evidence of practitioners who focused specifically on teeth as far back as 3000 BCE. They didn't have the tools or knowledge of modern dentistry, but they existed. Dedicated professionals attempting to solve one of humanity's most stubborn problems. One particularly striking example of Egyptian dental work comes from a mummy dated to the 21st dynasty, roughly 1000 BCE. Her teeth had been bound together with gold wire, a technique used to stabilize loose teeth. It's remarkably similar in concept to modern dental splinting. Archaeologists have also found evidence of what appear to be early dental bridges on Egyptian mummies, where adjacent teeth were used to support a replacement tooth. These are not crude attempts. These are sophisticated, considered interventions. And yet, here's something important. Tooth extraction, as we understand it today, was largely unknown in ancient Egypt. Egyptian dental practitioners overwhelmingly preferred to save a tooth, if at all possible, even when it was obsessed, infected, and causing obvious chronic agony. That philosophy, preserve at almost any cost, persisted in various forms for thousands of years, and it tells us something profound about how much people valued keeping their natural teeth, even when the process of keeping them was itself a kind of torture. Let's turn now to ancient Greece and Rome, where attitudes toward dental treatment began to shift in a significant way. Hippocrates, the Greek physician often called the father of medicine, wrote extensively about dental problems around 400 BCE. He described techniques for extracting teeth and recommended what we might now call pain management, including fumigation, where certain substances were burned and the smoke inhaled, presumably to dull pain and reduce infection. Aristotle, too, wrote about dental care in his works, including treatments for gum disease and techniques for managing decayed teeth. But it was the Romans who perhaps came closest to what we'd recognize as a professional dental industry. In the Roman Empire, there was an entire class of specialists called dens extractores, literally tooth extractors, who made their living performing extractions. These were not barber surgeons performing an occasional side task. These were dedicated professionals with specific tools, specific techniques, and a reputation that ranged from respected to deeply feared. The Roman medical writer Celsus, writing around 30 BCE, gave remarkably detailed instructions for tooth extraction, noting which teeth were safe to pull and which were dangerous, and describing forceps and other tools specifically designed for the job. The Roman approach, remove the problem and move on, represented a philosophical shift that was centuries ahead of its time. Meanwhile, on the other side of the world, ancient China was developing a very different approach to dental pain. Archaeological evidence and historical texts suggest that acupuncture was being used to manage pain, including tooth pain, as far back as 2,000 years ago. The Huangdi Neijing, one of the oldest books of traditional Chinese medicine, describes meridians related to the jaw and teeth and includes protocols for managing pain in those areas. Recent clinical research has shown that acupuncture can indeed be effective for certain types of dental pain, particularly pain related to temporomandibular joint disorders. The ancient practitioners didn't understand nerve pathways or endorphins the way we do now, but through centuries of careful observation, they arrived at treatments that, for some conditions, genuinely worked. As we move into the Middle Ages in Europe, dental treatment took on a very different character. Monasteries became centers of medical knowledge, and monks and nuns often provided rudimentary dental care, particularly tooth extraction, to their communities. But for ordinary people, the options were limited and frequently bizarre. The dominant theory of tooth pain during the Middle Ages was the toothworm, the belief that tiny worms or insects lived inside decayed teeth and were burrowing through the enamel, causing the pain. This theory had roots in ancient Sumerian texts from around 5000 BCE, and it persisted in Europe for millennia. Treatments designed to expel these worms included holding a candle made of wax and certain herbs close to the affected tooth, hoping the smoke and heat would drive the worms out. Other treatments involved boiling specific herbs and holding the hot liquid in the mouth. Some recipes called for powdered eggshell mixed with honey, applied directly to the aching tooth. None of these addressed the actual cause of the pain, but many would have provided temporary relief through heat, distraction, or in the case of cloves, which were commonly used, a genuine mild anesthetic compound called eugenol that modern dentistry still uses today. The medieval period also saw the rise of a remarkable figure in the history of dental treatment, the barber surgeon. Unlike the monks who extracted teeth out of religious duty, barber surgeons did it for money, and they were surprisingly effective. The iconic barber pole itself may have origins in this practice, the red and white stripes supposedly representing blood and bandages. Barber surgeons developed specialized tools for tooth extraction and became the primary dental care providers for most of medieval Europe. They were not gentle. Speed was considered a virtue, and a swift, brutal extraction was preferred over a slow, torturous one. But for someone in agony, a barber surgeon with a clean pair of forceps was sometimes the best available option. Through all of this, through the drilling in ancient Pakistan, The herbal remedies of Egypt, the fumigation of Greece, the extractions of Rome, the acupuncture of China, and the worm candles of medieval Europe. One thread remains constant. Tooth pain is a uniquely human burden. Every civilization, every culture, every society that has ever existed has had to grapple with it. And every one of them has responded with whatever they had. What the ancient record teaches us, more than anything, is that the instinct to seek relief from pain is one of the most fundamental and enduring parts of being human. The specific treatments changed, the tools evolved, the understanding of cause and effect slowly improved, but the drive to fix what hurts, to restore comfort, to keep living even when the body is screaming, that has never changed. Some of those ancient remedies genuinely worked. Clove oil, used in Egypt and continued through the medieval period, contains eugenol, a compound that modern dentistry still uses as a topical anesthetic. Willow bark, chewed by various ancient cultures for pain relief, contains salicylic acid, the active ingredient in aspirin. The ancient Chinese practice of acupuncture for dental pain has shown measurable effects in modern clinical trials. These weren't lucky guesses. They were the product of thousands of years of trial, error, and careful observation. Others were, by modern standards, useless or actively harmful. Lead-based compounds applied to an open dental wound would have done real damage. The toothworm theory delayed genuine understanding of dental disease for centuries. But perhaps the most important thing to take away from all of this is how far we've come and how much we owe to those who came before us, doing the best they could with what they had. A 14,000-year-old person drilling into their own molar with a sharp stone wasn't being foolish. They were being brave. They were being desperate. And they were being human, exactly the way we all are when we're in pain and we want it to stop. The next time you sit down in a dentist's chair with a clean, sterile instrument and a trained professional who has spent years understanding the biology of your teeth, take a brief moment to appreciate how extraordinary that moment actually is. It's the culmination of a journey that started 14,000 years ago with a sharp stone and a person who simply could not bear the pain anymore.